to downright ugly. Are ye ready for a journey into the darker side of cigarettes? Let's dive in. Nicotine doesn't travel alone. Oh no. It comes with its gang of baddie chemical friends. Cadmium, lead, arsenic, cyanide, hydrogen peroxide, nitrogen oxides, and carbon monoxide. Quite the rogues gallery, wouldn't you say? And trust me, they're up to no good. Your airways are marvelous little things. They're lined with mucus, produced by clever goblet cells. And beneath that mucus are ciliary cells with millions of tiny hair-like cilia that move in a wave-like coordinated rhythm to sweep out dust, debris, and nasty bacteria. It's a grand system. But then, oh dear, the tar from cigarette smoke barges in and mixes with the mucus, turning it into a thick, sticky, dirty mess. The poor ciliary cells, overwhelmed and clogged, stop their motion. Some even keel over from the stress. In response, your body ramps up mucus production, but this only makes things worse. What happens next? The dreaded smoker's cough as your body tries and fails to clear the airways. Meanwhile, your immune system says, "We can't have this." It tries its best to clean up the mess, but it ends up causing tiny micro wounds in the delicate lung tissues. This sparks a vicious cycle. More inflammation, more damage, more scarring, and a higher risk of infections. Before you know it, irreversible lung damage is underway. This paves the way to a nasty condition called chronic obstructive pulmonary disease, or COPD, which leaves you perpetually out of breath. Imagine needing an oxygen tank just to go to the shops. And it's not just the lungs taking the hit. Your blood vessels aren't spared either. Those nasty chemicals in cigarette smoke, combined with our own immune response, cause micro wounds in the vessel linings. Fatty cholesterol deposits start to stick to these damaged areas. These are called atherosclerotic plaques. These plaques narrow the vessels, making it harder for blood to flow. They are fragile and can break off and float down to smaller vessels, blocking them entirely. And what happens when a blood vessel to your brain gets blocked? You guessed it, a stroke. If it's your heart, well, that's a heart attack. Nicotine makes your heart beat faster and your vessels constrict. This cranks up your blood pressure. In the long term, these effects causes strain on your heart, eventually leading to heart failure. Poor blood flow can affect your limbs too. It starts with a condition called intermittent claudication, when you experience calf pain after walking a short distance. But it may end up with painful gangrene, which will result in you losing a limb. Now, let's talk about your skin. Those same chemicals wreak havoc here too. They damage skin cells, breaking down collagen, the protein that keeps your skin smooth and elastic. The result? Premature aging, wrinkles, and lines. You'll be looking older before your time, and no one's thrilled about that. Now for the big bad wolf of smoking, cancer. Cigarette smoke is a witch's brew of around 70 carcinogens, those nasty chemicals that mess with your DNA. Damaged DNA makes your cells go haywire, multiplying like there's no tomorrow, forming growths we call cancer. Lung cancer is the most common, but don't forget, smoking is linked to 16 different types of cancer. Here's a sobering thought. For every pack of cigarettes you smoke, you lose about 28 minutes of your life. Over a lifetime, the average smoker loses 25 years. 25 years, gone up in smoke. That's not just a price, it's a fortune.